The cardiovascular system, the heart. The heart as an organ, the coronary blood supply. Myocardial cells require their own blood supply to carry out their function of contracting and relaxing the heart in order to pump blood. Their own blood supply provides nutrients and oxygen and carry away carbon dioxide and waste. These functions are provided by the coronary arteries and coronary veins. The heart's electrical conduction system. In order for all parts of the heart to work together to beat regularly and effectively, the heart has its own electrical system, which initiates and conducts each heartbeat through the entire myocardium. Specialized groups of heart cells perform this function all on their own without requiring messages from the central nervous system. We can detect and record the electrical activity of the heart's conduction system using an electrocardiogram, an ECG, or EKG. The electrical impulse originating in the SA node and travels through the heart's conduction system, allowing the heart to complete one cardiac cycle. Each waveform on the ECG tracing represents electricity moving through and affecting a different part of the heart. Did you notice that the AV valves close when the electrical impulse reaches the ventricles just before systole occurs? Some diseases and disorders. Cardiomyopathy. The heart of a well-trained athlete can be considerably larger than the average person's heart. This is because exercise results in an increase in muscle cells called hypertrophy. Hearts of athletes can pump blood more effectively at lower rates than those of non-athletes. However, when an enlarged heart is not the result of exercise, it may be due to hypertrophic cardiomyopathy. The cause of an abnormally enlarged heart muscle is unknown, but the condition is often undiagnosed and can cause sudden death in apparently otherwise healthy young people. Other types of cardiomyopathy include dilated cardiomyopathy, which also has an unknown cause and is seen in people of any age. In this disorder, one of the ventricles of the heart is larger than normal. Arrhythmogenic cardiomyopathy, an inherited condition which results in irregular heart rhythms. Restrictive cardiomyopathy, which is a complication of other conditions which cause the myocardium to scar or stiffen. Cardiomyopathy may also be caused by myocardial infarctions, myocardial infections, pregnancy, alcohol or cocaine abuse, autoimmune and endocrine diseases. Because the myocardium is responsible for contracting and pumping blood, patients with cardiomyopathy experience impaired heart function, which may lead to heart failure. Heart failure. Heart failure is defined as the inability of the heart to pump enough blood to meet the needs of the body. It is also called congestive heart failure, or CHF. This condition causes swelling in the lower extremities and shortness of breath due to buildup of fluid in the lungs. It may be caused by cardiomyopathy, and it may lead to hypertension and heart valve disorders. Valvular heart disease. The four heart valves open and close at specific times during the cardiac cycle in order to ensure that blood flows in only one direction through the heart. This requires that these valves open and close completely. Infections such as rheumatic disease or bacterial endocarditis can affect the heart valves and result in scar tissue formation, which interferes with valve function. Other causes of heart valve disease include congenitally malformed valves, autoimmune diseases, and other cardiovascular diseases, such as aortic aneurysms and atherosclerosis. Heart valve disease may be asymptomatic or cause dyspnea, arrhythmias, fatigue, and other symptoms. It is often detected with a heart murmur, is heard through a stethoscope. Mitral valve prolapse. The mitral or bicuspid valve is diseased or malformed and is not able to close completely, allowing the regurgitation of blood back into the left atrium during asystole. Because some of the blood goes back into the atrium, insufficient blood is pumped out of the ventricle into the systemic circulation. This inability to close properly and the resulting regurgitation may also be found in other heart valves. Aortic stenosis. The aortic valve is narrowed and hardened, preventing it from opening fully and allowing sufficient blood to travel to the systemic circulation. Any heart valve can be stenosed, but this disorder most often affects the aortic valve. Aneurysms. An aneurysm is a defect in the wall of an artery in which the wall becomes thin and weak and starts to balloon out as blood pulses against the vessel wall. This can happen to any artery and even to the myocardial walls. Aneurysms sometimes occur in the portion of the aorta that is in the thorax. If these aneurysms start to leak between layers of the vessel wall, the condition is known as aortic dissection. If an aortic or cardiac aneurysm bursts, there is sudden massive internal bleeding. People who smoke, have hypertension, hypercholesterolemia, and or atherosclerosis have an increased risk of developing aneurysms. Having a family history of aneurysms or certain genetic diseases may also increase a person's risk of developing an aneurysm. Aneurysms are often asymptomatic and may be detected incidentally during diagnostic tests that are being done for other reasons. They are sometimes repaired surgically and sometimes treated with medications such as antihypertensives. Heart defects. Fetal circulation is different from postnatal circulation. There are two extra openings in the fetal heart, the foramen ovale and the ductus arteriosus, which allow blood circulation that bypasses the immature fetal lungs. The fetal blood is reoxygenated by the mother's lungs and transported between mother and fetus via the placenta. These two openings usually close around the time of birth. Septal defects are commonly first detected through auscultation. Unusual heart sounds may be detected because blood is not flowing and valves are not closing correctly. Medical imaging is ordered to confirm or rule out a diagnosis. In many cases, treatment may not be needed. Patent ductus arteriosus is a congenital condition in which the ductus arteriosus fails to close. If untreated, the condition can result in congestive heart failure. Patent foramen ovale is one type of atrial septal defect, or ASD, due to a failure of the hole in the interatrial septum to close at birth. As much as 20 to 25% of the general population may have a patent foramen ovale. Most have the benign asymptomatic version, but in extreme cases, a surgical repair is required to close the opening permanently. Tetralogy of Fallot is a congenital condition that may also occur from exposure to unknown environmental factors. It occurs when there is an opening in the interventricular septum caused by blockage of the pulmonary trunk, normally at the pulmonary semilunar valve. This allows blood that is relatively low in oxygen from the right ventricle to flow into the left ventricle and mix with the blood that is relatively high in oxygen. Symptoms include a distinct heart murmur, low blood oxygen percent saturation, shortness of breath, dyspnea, polycythemia, clubbing of the fingers and toes, and in children, difficulty in feeding or failure to grow and develop. It is the most common cause of cyanosis following birth. Other heart defects may also accompany this condition, which is typically confirmed by echocardiographing imaging. In the cases of severe septal defects, including both tetralogy of Fallot and patent foramen ovale, failure of the heart to develop properly can lead to a condition commonly known as blue baby, regardless of normal skin pigmentation. Individuals with this condition have an insufficient supply of oxygenated blood, which leads to cyanosis, especially when active.